Over 7,000 people have signed a petition calling for medical professionals, that includes doctors, nurses and midwives, to report incidents of teenage pregnancy to police. Now, social activist Kekeletso Khena started the movement following the alarming rise in teen pregnancies in the country. The latest data from Stats SA also reveals that more than 90,000 girls between the ages of 10 and 19 gave birth from March 2021 to April last year. Let's discuss this petition further and unpack the salient issues and bring in Kekeletso Khena, who's the Operations Director at Women and Men Against Child Abuse. Now, I beg your pardon, you're part of this particular petition as well, and you're a social activist. Our other guest is part of that organization who we'll speak to in just a moment. Kekeletso, thanks for your time and welcome to the AM Report.
Thank you so much for having us.
Those are staggering numbers. Let's begin there, right? More than 90,000 teenagers, quite frankly, giving birth between March 2021 and April last year.
Right.
That really points to how major a problem this is.
It really is a problem. And I think what makes the problem even bigger is how this problem is placed squarely on the shoulders of the girl child. If you go into Twitter, when people got to notice the campaign, the sort of negative comments that we have read still in 2023 are placing the blame on the pregnant teenager. Nobody's asking the question of why are teenagers getting pregnant. And in particular, what raised our interest was the 10-year-old, the 14-year-old, the 12-year-old, the 16-year-old is getting pregnant because those ones are under the age of consent. So nobody's asking the questions and everybody just wants to blame these children as being forward. There's clearly a problem there, much bigger problem.
Absolutely, and I suppose that gives us a window into why a lot of these incidents go unreported, right? There's concerns around stigma, fear, being ostracized and being blamed, quite frankly, as a child.
Certainly, and there's also the other issue that we're not talking about, the status of women in general, but more so the status of poor black children in general, who, and particularly girls, who then find themselves more vulnerable to being preyed upon by predators who have a little bit of money to spend, who then lure these girls into relationships or even just a loaf of bread. It's that complex, and how sometimes parents are actually part of the problem.
Sure. I spoke about another guest who might be joining us, and it's Vincentia, Dlamini, who's with Women and Men Against Child Abuse and joins us via our video link. Vincentia, it's great to have you and your insights on this discussion as well. In the line of work that you do, what have you been able to ascertain drives children, quite frankly, into a point where they land up in situations where they ultimately give birth?
Thank you for having me. This is a serious and a matter that needs our attention because we have been talking about it as an organization because we know that even though there's current legislation that does put an obligation on everybody who's a professional working with children that they need to report these cases. But we find that that is not happening. Children go into our labor wards and they get out and then they go back to the community and give birth and nobody says anything. Children go to school and then the school knows that the child is pregnant and they know that this is a minor and nothing is happening. And we know that this is one of the most vulnerable groups, and as adults, we have a huge, huge responsibility to protect them. And we do have those laws. We just have to implement them.
Yeah, and maybe that's a good part to introduce the petition, right? Tell us a bit more, Kekeletso, about what the petition is calling for, because Vincentia explains to us that the laws are there already.
I think we are making an assumption. The Child Protection Act definitely makes provision for it to happen. However, if you go to the patient-doctor confidentiality laws, that literally immediately precludes the doctors from being able to report this. So, and this is why the campaign is necessary, to enable the Department of Health to make a specific policy that enables doctors within the legal framework to then be able to notify other authorities of the pregnancy of the child. So this petition is basically asking the Department of Health to develop a policy where if a child shows up pregnant at a hospital or even in a traditional healer's practice, they would then be required to notify the authorities. And when we're talking about authorities, we're not talking about just police, which is what everybody is thinking. Obviously, the police needs to be told. But can you imagine what the mental health status of a 10-year-old who's about to be a mom is. And that child needs support. So you definitely need a social worker. You need a psychologist. That child needs an entire program to assist them to deal with this reality of their lives. And at this point, there is absolutely nothing within the government system that is geared towards ensuring that this child can actually be supported to try and live a better life and make even better decisions for themselves. There's nothing in the system.
I actually cannot wrap my head around a 10-year-old giving birth when they are not necessarily even they haven't even come to terms with their own existence, let alone caring for somebody else. But the petition we referenced is on the screen now, and I see the support has really come through. If we're able to take down our strap, you'll see that there it is at the top, actually. More than 7,000 signatures have now been attached to it. But Kekeletso, let's speak about the unintended consequences if this does go ahead, right? I can imagine people saying, if a child knows that the law compels whoever's helping them to report them to authorities, then many more children might be afraid to come forward. What's your response to that?
Let's start by saying that this is a child who's potentially being raped. This 10-year-old did not consent to sex because they cannot.
Right.
So this is a child who's been raped. Let's start there. So children do want people to know that have been violated. Let's just be honest. And it is the adults that are actually coaching these children into hiding this. Let's start there. But also imagine this child who is now saying, if people know that Ubaba Mkhize raped me, it's not because I told. Therefore, there is no ramification for me or my family. It is the system. It was the doctor that told. It wasn't me. So it kind of takes away the responsibility from the child to be the one that tells people that this is what happened. But it actually places it on the adults to be able to protect the child, which is what we are supposed to be doing. We are supposed to be protecting children. People are going on and making hypothetical assumptions about how children don't want people to know. Why is a 10-year-old wanting to hide the fact that Ubaba Mkhize has made her pregnant? Why is a 10-year-old being pregnant? Those are the questions we should be asking and not trying to block something that is going to ensure that we can protect these children, even within communities, because if the child is taken away from the formal healthcare sector and is taken to a traditional healer, a doula somewhere, when you know in your township that there is a 13-year-old that is pregnant and suddenly they're carrying a child, you know they gave birth. They must now tell you, you must then find out where did that child give birth. That person that helped that child give birth must then be held accountable. This is what we are asking for. Everybody must be held accountable if you do not report that a child has been pregnant, because we really do want to know what happened to the child. We want to know who impregnated the child. We don't have those statistics. You go to the police and you ask them, what are the statistics on pedophiles in South Africa? What's happening with child rape? We don't have those statistics, and this is the beginning of us being able to capture those statistics, but also to develop a support program for these girls when none exists.
Absolutely, and that's exactly where I was hoping to go with Vincentia, who's joining us via our video link. Do we know who these people are who are raping these children? Because I imagine that's a good place to start if we're going to safeguard them, you know. And I suppose it's been answered in part that we don't really have data to get us a sense of who is involved in the statutory rape.
The thing is, a lot of this happen within homes, and they happen in secrecy. And that's why these continue to happen, because the perpetrators of this gruesome violence, they know that, you know what, they have a hold on these children. They know that they are breadwinners. They know that they threaten children not to talk. And that is why when you look at the Children's Act, it does put provision in Section 110 to say that professionals need to report. But there is a gap. It doesn't say everyone needs to report. And I agree that as long as you're an adult, if you're a mother, you're an aunt, you're a neighbor, you know that this child has been sexually abused, you have a legal obligation to report. So there is a gap there that we need to address, because it will continue. And the reason why it continues, because there are onlookers and there are enablers, people who say that, you know, there are mothers that we know that they will take groceries from these elderly men so that their children can actually have these sexual, I'll call them sexual relations, but actually it is rape.
Right.
Because, we are turning a blind eye on this. And people must not, and sometimes the lack of knowledge is a problem, because you can't say a 9-year-old consented, and you call it statutory rape, anybody less than 12 cannot consent. Even if they believe that they are in a relationship with this man, they cannot, they don't have that ability. They are under 12, so that is rape. It's rape. Then above 12, it's something else. And, you know, we have a huge responsibility as a country. And if we are going to be coming in and thinking, oh, the child doesn't want this, the child doesn't, we have, you know, the Children's Act puts, you know, the best interest, you know, of children as the most important thing. And the best interest is that we cannot keep quiet. And I know that there is doctor-patient confidentiality, but it does not supersede the law. The law says professionals must report, you know, because they're continuing and these children are coming in. So that part, patient, and the other thing is that we know there's a lot of barriers that we have. And sometimes the doctors themselves, even the nurses, they don't want to be part of it because they are scared. But the law does say there's not going to be a civil claim against any professional that reports. And we need to hold people accountable, because if you are there, you are entrusted with the safety of the child. You are a custodian of this child. And as a result, you have a responsibility. And failure to report is a criminal offense. And I think now with this petition, what it needs to push that they have to have these policies, because the law is there. And then those policies needs to be clear as soon as a child comes in. Because even in the United Convention on the Rights of the Children, it does put a responsibility on us as a country to protect our children, to say, we must investigate this. Even if a child comes, let's say they are 15, and you ask them as a nurse to say, who's the father? And they say it's a 16-year-old boyfriend. But you need to send it for investigation, because the child might be lying about it. So those policies need to be clear, have proper guidelines to say, how do we investigate? Send these children to social development, social welfare, to the police. Okay, police is another story, but yes, we need a system where children are going to be in an environment where they are going to be catered for mentally and be protected.
Absolutely. I want to just hone in on something you mentioned briefly, Vincentia, before we come back into studio, and that's the issue around language. You know, for years, even the media has come under fire for how we describe these incidents, right? In many instances, you know, headlines will speak of teenage pregnancies when, quite frankly, perhaps a more appropriate description would be to call them what they are, which is rape.
Yes.
Sure. The next steps, Kekeletso, when we think about what happens after this, when it comes to ultimately changing the law in how they respond to teenage pregnancies, what are you hoping comes out of the petition, practically speaking?
Practically speaking, we are literally just looking for a policy that would ensure that you know, the pregnancies of minors is a notifiable incident. That's one. But the policy must also make provision for the support of these children. And thirdly, we are hoping that there will really be arrests and investigations. I mean, it cannot be that, you know, I think a lot of people are thinking, oh, but the state is so incapable. The state is incapable, but we also have a responsibility to then hold the state accountable and make sure that the state does what it is that the citizens want. Because in our engagements with the department, they're dilly-dallying around this issue and they're making all kinds of excuses. And I think this is why the campaign is so important, and so important that people still continue to sign the campaign, because it tells them that there is a voice, there are several voices that want this thing done. So we are hoping that we can change the lives of children. We can prevent pedophilia in this country, because that's what it is. We have pedophiles, we have rapists who are preying on children, and we want to reduce those numbers, and we want to be able to close as many loopholes as we possibly can when it comes to protecting our children. Yeah.
What happens to those children after this has been reported, after they've given birth, especially in a context where we realize that the very danger, in fact, that they're trying to be protected from comes from their homes?
Absolutely. I think what Vincentia was saying earlier is, you know, nobody talks about how our country has an intricate legal system, in the sense that in as much as we have the Roman Dutch law, which we've inherited, we also have customary law, where in the case of Sibongile, 10 years old, rocking up pregnant in Mzimkhulu, a guy can just literally go to the parents, give them 2 cows and say, I'm paying for the virginity, and then I'll give you another cow, and that's now uklaula, and that's the end of the story. And if that person is is employed and, for instance, is Sibongile's teacher, the parents are already thinking, oh, this child must be maintained. We cannot maintain this child. So let's make sure that this person is protected and they don't go to prison, because ultimately they must still maintain this. So we must also understand the context within which this happens and the socio-economic context of this country and how the poverty of our people has led to the abuse of our children. There's something seriously wrong with how we are doing things, because when we keep communities impoverished and poor, we, at the end of the day, are not just compromising. We are compromising children. We are compromising women. It's ludicrous what this government cannot see is the impact of their incompetence, so to speak.
Absolutely. It's a multifaceted issue, and thanks very much indeed for helping us at least think through these different issues. And hopefully, there is a desirable outcome on the other side of this petition. Kekeletso Khena is a social activist, and joining us via our video link is Vincentia Dlamini, who's with Women and Men Against Child Abuse. To both our guests, thanks very much indeed for your time.
Thank you for having us.